UMC's trauma center after she sustained a traumatic injury to her right hand.
Missing bone from the top of her hands. These two knuckles were missing bone. This bone was shattered. Her thumb and her pinky were still intact at that point, and then all the muscle and tissue in this area, besides her palm, was completely missing.
Local reconstructive surgeon Kayvan Khiabani was on duty and performed the initial surgery to save Hannah's hand and ensure it was free from infection. Then he outlined his treatment plan for saving Hannah's hand. He also encouraged her parents to get a second and even third opinion.
I called everybody that I could call in Mayo Clinic in Arizona and was actually turned down by two hand surgeons at the Mayo Clinic. They did not want to take someone so young, take on a case that was so, such a hard case, because they couldn't come up here and see it, and they didn't want me to bring her all the way down there without seeing it, and also because of her age. They just don't take patients under the age of 16 very often down there. So I called UCLA, which was the next best place, and talked to a couple of people out there and ended up being referred to Dr. Jones, Neil Jones, and who's supposed to be, the best hand surgeon out there. And he said, "I'm leaving the country, and you need to call Dr. Khiabani." And I said, "Well, that's her doctor." And he said, "Well, I trained him, so, he's the best guy out there, and he's got amazing hands." So.
Dr. Khiabani's plan was a complicated one, using bone from Hannah's hips to reconstruct the bones in her hand, then using tissue from her forearm to form the back of her hand.
Hannah's angel, her superstar, was here in Vegas, and I did enough research, and I have some doctor friends here in the city as well that did some research on Dr. Khiabani, and everybody was very, very excited about it.
And what does Dr. Khiabani say to that?
I'm not a superhero, I'm just a doctor, I'm just doing my job.
Recently,